Hello, I'm Jennifer Jenkins-Boitnott at Glass LLC, and today I just wanted to give you some tips on how to get organized and stay organized with your EMDR client files. I think that the easiest way to keep track of all of the things that you need to keep track of as you're doing EMDR is to just use a good old-fashioned paper folder. This is not where I do my, clinical notes, but this is where I keep all of my EMDR notes that I jot down during session, all of the things that I need to be able to remember when working with a client on EMDR. And the best way that I have found to keep track of all of the things that you need to remember is to just make yourself a little list. I put this in the front of each of my files, and I just have all the things that I need to know in a way that works for me. So I have their testing scores, what they scored in the DES or the mid, whichever one I gave them, what type of bilateral are we using, knee tapping, when we were in the office, knee tapping, eye movements, the tappers, headphones, butterfly taps, whatever it is that we're doing. I circle that so that I know that we've talked about it and I can then remember which one we're doing. A list of the different types of resources that they have, what's their container, what's their place, any other resourcing that we've done. If we've done meeting place, a list of the parts of self that we've worked with. Anything like that that you need to be able to quickly glance at when it comes up and you need it in session. And then I also jot down what type of protocol are we using? Are we doing standard protocol, early trauma, ATIP, the COVID one, whatever protocols I'm using with them, I'll jot that down too. And then that way, when I'm in session and I open up the folder, I can just really easily see, oh, right, okay, this client's container is this. This client's place is this. And then that way it's fresh in my mind as we're doing the session. When I need it, I can just pull that right out. So that is my tip. Keep it simple and stay organized.